Hi, I'm Dr. Mulholland. We're here talking about the PicoSure, the latest ultra-short pulse duration tattoo removal device on the market. 4 treatments, 90% reduction, all colors. Pico's been a big game changer. And if you want to change it, let's say you want a bigger spot size or more commonly a smaller spot size, remember down around 2 with a boost gives you 70% more power. For difficult issues, you go down to 2, hit the boost button and get 70% more power. Difficult reds might be one of the times you use that. You simply unhook this, twist it around, get down to 2, you bump around 6 joules per centimeter squared. And when you see the Heaney beam, you're ready to go. So we got the Heaney beam, you're ready to point and shoot. You like all your parameters and settings, we come back to our patient. Now if you look at his tattoo, this is a beautiful tattoo set up for 10, 12, 14 treatments with nanosecond technology. However, hypopigmentation is the risk. With a Pico, I'm shooting for 4 treatments, 90% plus reduction. Okay, you ready, young man? Ready. We'll start out with that little number 3 up here, okay? Number 3, we're gonna trace it out. You simply, it's a foot plate a type of technology. You put it on the skin and you basically trace. Is that acceptable, sir?
That's acceptable.
You see that frosting? That is the frosting of a photomechanical effect. Now when it fades, there'll be very little erythema. We'll get to see his arm tomorrow. With the nanosecond technology, all kinds of redness, yicky, often bleeding, and the scab comes off. It's about 10 days till it recovers. Not so much with the Pico. Quicker recovery, fewer treatments, better clearance. Now that he tolerated that, we're gonna go to his other tattoo areas with 3 millimeters, and there we go. Acceptable?
Yep.
You're doing outstanding, sir. Very, very brave of you. I usually break this into segments. Excellent. Very nice. Very nice reaction. Often with a Pico, you'll get about 25–30% reduction in the very first treatment. And just outline your tattoo. This kind of tattoo would be medium sized. In my clinic, we would charge anywhere from $350 to $500, depending on the actual patient itself. We would do this at 6 to 8 weeks apart, and we'd get probably close to 90%, 85, 90% clearance, but we'd tell him about 75 to 80% in that 4 treatment program. He could buy that product up front and probably save 20%, or he could pay as he plays. Excellent. So when you had this tattoo on, what would you say is the pain difference, this versus getting it on?
This is less than the tattoo.
Less than tattoo. Would you say it's 50% less? Would you say it's, what would you say in terms of?
25%.
25% of the pain of getting it on. Now, if SpaMedicaTV had been more humane, they would have remembered to bring the topical anesthetic cream. I see that Jesse doesn't like you too much because he didn't offer his. Do you guys work in the same market?
Yes.
You do. Are you guys buddies?
Of course.
Of course he's buddies. Yeah, there he is. Just didn't give you his anesthetic cream, the bastard. Okay, so we got a very nice response here. That's a very nice response. The frosting is indicative of a great reaction. It's already starting to lighten where we first started. You see the dark is coming back. Within about an hour, the frosting is gone. What used to have been crusty and bleeding points and a week of covering up with the nanosecond technology, now more like 2 or 3 days. We'll use some topical polysporin, a little Band-Aid. He would change that tomorrow, maybe go to olive oil or Vaseline or Aquaphor. And usually by about 3 days, it's re-epithelialized. Keep it out of the sun for that first 2 weeks. And be back in 6 to 8 weeks. 4 treatments, 75 to 80% reduction would be very, very common. 90% is what I shoot for. So if patients have a